Hello, my name is Dulce Anding and my presentation is on hepatitis A. So hepatitis A virus or HAV belongs to the class of viruses called Pisoniviricetes, the order Picornaviridae, the family Picornaviridae, and the genus Hepatovirus. Characteristics and biology of HAV. It is a small, non-enveloped icosahedral capsid, which means spherical in shape. It is also a single-stranded RNA molecule. HAV attacks the liver and infects hepatocytes, which are the chief functional cells of the liver, causing inflammation. In order to evade innate cellular antiviral defense mechanisms, HAV inhibits the induction of both interferon synthesis and apoptosis. Signs and symptoms. Hepatitis A is a short-term liver infection, and not everyone with hepatitis A has symptoms. Adults are more likely to have symptoms than children, and if symptoms do develop, they usually appear 2 to 7 weeks after infection. Symptoms usually will last less than 2 months, but some people can be ill for as long as 6 months. And these symptoms include yellow skin or eyes, also known as jaundice, reduced appetite, upset stomach or stomach pain, nausea or vomiting, fever, dark urine or light-colored stools, diarrhea, joint pain, fatigue, or feeling weak. How hepatitis A is acquired. The hepatitis A virus is highly contagious and it's found in the stool and blood of people who are infected. The hepatitis A virus is spread by consumption of contaminated food or water. Contamination of food with hepatitis A virus can happen at any point from growing, harvesting, processing, handling, and even after cooking. Contamination of food and water happens more often in countries where hepatitis A is common, like developing countries. But although uncommon, foodborne outbreaks have occurred in the United States from people eating contaminated, fresh and frozen imported food products. It is also spread by close personal contact with someone who is infected, like caring for the infected person, or through sexual contact. People who are at an increased risk to acquire HAV include international travelers, people experiencing homelessness, people who inject drugs, and men who have sex with other men. Pathogenesis. HAV is typically transmitted through fecal-oral route and replicates in the liver. After 10 to 12 days of infection, the virus is present in the blood and is excreted via the biliary system into the feces. Virus excretion begins to decline at the onset of clinical illness and decreases significantly by 7 to 10 days, but virus excretion may continue for up to 3 weeks after onset of symptoms. Treatment. There is no specific treatment for hepatitis A. Therapy is aimed at maintaining comfort, rest, managing nausea, and maintaining an adequate nutritional balance. Your body will clear the hepatitis A virus on its own, and in most cases of hepatitis A, the liver heals within 6 months, leaving no lasting damage to the liver. People who have had the disease result in lifelong immunity, and for prevention, it's important to practice good hygiene and sanitation. Thoroughly wash your hands often, especially after using the toilet or changing a diaper and before preparing food or eating. And lastly, here are my sources. Thank you everyone for listening.